Hello and Assalamu alaikum, Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is all four quadrants. We'll take you through the upper quadrant first. The upper right side, the doctor has asked us to place virtual implant, but here implant placement is impossible because of the nature of the bone. We don't have any bone. So until and unless sinus lifting is done, and that too quite significant sinus lifting will be needed because there's absolutely no bone in the region of the 5 and the 6 for any kind of implant placement. The upper left segment is also, there's no bone here either, as you can see, no bone here, no bone height, no bone width. So significant sinus lift will be needed in order to place an implant. The upper left 7, however, is a BDR, and again, once this BDR will be removed, significant grafting will be needed to place implants. Moving to the lower left 8. The lower left 8 has a periapical radiolucency, so significantly ground away will need to be extracted. The lower left 7 seems to be doing well with the class 1 cavity. The lower left 6 has a class 2 cavity mesio-occlusal, which can be protected by endodontic treatment. So this has 2 canals in the mesial and has 2 canals, or initially 2 canals which join to form 1 canal in the distal. The approximate working length in the distal is 22 millimeters, and the approximate working length in the mesial is approximately 21.4 millimeters. So the lower left 5 is doing well, has a post, no periapical radiolucency. The endodontic treatment is not very adequate, but there are no radiolucencies, and the tooth is sitting right above the inferior, the mental nerve. This is something to be kept in mind. The only area where we can place implants are the lower right segment. The lower right segment, we have approximately 7.8 millimeters of ridge width with 17 millimeters of height. This is in the region of the lower right 4, and the region of the lower right 6, we've got approximately 6.9 millimeters of ridge width with 12 millimeters of height. We cannot place an implant in the region of the 5 because there is a root which is left from the previous extraction, and as you can see, pulpal space is also present. So this root is covering the entire space for the region of the 5. So 2 implants can be placed in the region of the lower right 6, for 4 and 6, and these are how the implants look. An implant supported prosthesis can be easily be placed here. Thank you very much.